The reason that we did the Pew report was because we wanted to measure how states were doing so that when they try to improve access to dental care for children, they know where to start. We have 8 benchmarks. They're about sealants, water fluoridation, whether or not you have an adequate workforce to care for children, whether there's adequate financing and access in the Medicaid system, and then whether or not states collect data, because if you don't collect data, you can't measure your progress. 22 states improved their grades on 1 or more of the 8 measures that we collected data on. An A means that states did a lot right, but it does not mean that they're done. There's a lot more work to do in every single state. If, for instance, you're a state where only 40% of your children enrolled in Medicaid had a dental visit, what about the other 60%? There's a lot more left to do. One of the good news things about this report is that states can make progress without spending money, or at least not much money. Investing in community water fluoridation saves a state money. Sealants are a way to save money in restorative costs down the line, and enacting a new workforce model costs very little money, at least in upfront costs. Well, most people don't know that dental care is the biggest unmet health need among children. It affects everything. You can't really close the achievement gap if you have unmet dental needs because kids won't perform well in school. And children with poor dental health often grow up to be adults with poor dental health, so they have trouble getting and keeping a job. What we hope at Pew is that policymakers will take a look at this report, take a look at their state grades, and get ideas for how to make progress to improve children's dental health in their state. This is a fixable problem, and we have to address it.